Hi students. I'd also like to address vaccines today, given how integral they are both to a number of vertical programs and to primary healthcare. Vaccines are one of the most effective and cost-effective technologies in global health. They are a major reason for the decline in infectious diseases around the world. And as you know, the global biotechnology community and medical community and public health are all coming together in an intense search for a effective vaccine to treat COVID-19 and then plan for implementing it and distributing it to populations once that can be developed and produced. All vaccines do carry some risk. The specifics of the risk vary by vaccine. If you get a vaccine in the United States, you'll be provided with an information sheet that details the risk for the vaccine you're receiving. But the benefits of the vaccines that are recommended for children in the United States and around the world vastly outweigh the risks. When high percentages of people in a population are vaccinated, mortality and morbidity from vaccine-preventable illnesses all but disappears. On the other hand, the most common side effects of vaccines are a sore arm or a low-grade fever. The current recommendations for routine childhood vaccination in the United States provide protection from 14 different infectious diseases, including chickenpox, diphtheria, Haemophilus influenza B, also called Hib, hepatitis A, hepatitis B, the seasonal influenzas, measles, mumps, pertussis, pneumococcus, rotavirus, rubella, and tetanus. These are in addition to the vaccines that are recommended for adolescents and adults, being human papillomavirus or HPV, herpes zoster, seasonal influenzas, meningococcal disease, pneumococcal disease, and varicella zoster. The best way to protect a child's health is to give them vaccines on schedule. The small risks associated with vaccines are not lessened by increasing the time between the shots. Spacing out vaccines over additional time actually increases a child's risk of disease, since they are less protected against vaccine-preventable diseases in the interim between the inoculations. But fears about vaccination are common. In part, this is because it's a medical procedure done on healthy people that carries risks, albeit small ones. Sometimes concerns about vaccination arise because people do not have complete trust in the government or other agencies providing or recommending the vaccinations. And often people have good reasons for distrust. However, receiving vaccinations recommended by the CDC and the WHO on schedule is the best decision for one's and one's child's health.